Now, in terms of reducing inflammation, so I'll talk generally, but I'll also kind of feed back to those two, the autoimmunity and the mold illness that I just mentioned. So tip number one, and I guess it's quite a big multi-stepped tip, is to work on what I would call the 5 pillars of wellness. So these are nutrition and hydration, sleep and relaxation, exercise and or movement, depending on what you're able to achieve, stress and resilience, and relationships and networks. So focusing on, I'll leave nutrition to last. Everything else I think is relatively not easy, but simple to understand. So hydration, you need to be getting, depending on your weight, usually 2+ liters of filtered water per day. You need to be having good sleep hygiene. You need to be doing some kind of relaxing activities. You need to be moving, even if you can't do, typical exercise or kind of high intensity exercise, going for walks, doing gentle yoga or stretching, anything to just move the body is great. Stress management techniques, really, really important, particularly if you have stressful events that can't be avoided. And then just nurturing those relationships and networks, right? Making sure that they're positive and that you have support around you. And then coming back to nutrition, I think really there are so many different, protocols that can be good for one person that aren't for somebody else. What I really promote is a whole foods diet. I think that's the most important thing. If you can stick to whole foods, very low processed is the biggest, the most important factor. And then I would also say, when we're talking about reducing inflammation, you really want to be removing the top inflammatory foods, and if you really want to move the needle, so these are things like gluten, dairy, and sugar would be the top 3. And then you have to kind of figure out what the others are for your particular body. Sometimes soy can be problematic, especially for people with autoimmune conditions. Sometimes eggs can be problematic, yeast. There's various different things, and you need to kind of figure out what they are to get the best diet for you. And these can really have a big impact on autoimmune conditions and SIRS. So removing all of the inflammatory stuff can really just give the body a little bit of a reprieve while working on the root causes, as I mentioned before. The second tip I would say is to support the gut. So as I mentioned, for autoimmune conditions, there is always this kind of leaky gut component. And one of the kind of complex stages in the SIRS journey is also about, there's digestive issues, and there's a hormone that kind of creates, it's not actually leaky gut, but it's very similar in how it presents. And so both of those conditions, or, types of conditions, we really want to be supporting the gut, but really any chronic illness, anything where inflammation is a key contributor. And so some of the easy things that you can do at home without a practitioner, I would say bone broth is fabulous. So as long as you're not histamine intolerant. So, adding bone broth to foods, to casseroles, to curries is great. Drinking it like tea. It's got a lot of collagen and nutrients. You can also add other kind of mucousy type products like aloe or slippery elm. I would be adding those to a smoothie or something like that, because they're not great to drink on their own. Probiotic rich foods, so sauerkraut is a great one, kimchi, whatever kind of takes your fancy. And then the other thing that I think is often missed, that is quite a simple thing to do at home, is to really think about how you can optimize digestion in terms like behaviorally. Okay, so sitting down to eat, smelling the food before you eat to get those salivary enzymes flowing so that your, digestion is primed. That will set off the stomach, the stomach acid and the digestive enzymes further on. And that's what you want to be happening. That will make sure that kind of motility is optimized. You know, making sure that you're chewing your food properly, that you are spending at least kind of 15, 20 minutes even eating a meal, not 5. So all of these behavioral things are also really helpful to support the gut. And lastly, tip number 3 would be to reduce toxins. So I'm not talking about from a kind of big picture perspective, like I was talking about mold. That's a bit of a different story. I'm talking about the little things you can do day to day to reduce the level of toxins in your life. So things like filtering your water, buying organic produce or organic or grass-fed meats, you know, using glass containers instead of plastic, and definitely not heating up plastic containers in the microwave. Choosing fish that aren't high in mercury, so, you know, minimizing tuna and such fishes, not cooking with Teflon, removing beauty products that have phthalates and parabens. So all of these things can be really helpful in just reducing the toxins and giving the body a little bit of a break. They may not be the primary root cause, but they will allow the body to kind of get into a bit more of a resilient state while you're searching for those root causes. Obviously very helpful when you're talking about mold illness, when it's, you know, there is a major toxin that likely is the root cause, but also in autoimmunity, toxins are often part of the picture. So this can be really helpful.